People pay the highest prices in the world for prescription drugs, which means that millions of people who go to the doctor to get a prescription are simply unable to afford to fill that prescription. And that, Mr. President, is the definition of a dysfunctional, failing healthcare system. And in the midst of all of that, there is another particular crisis dealing with primary health care. And that is, even when people do have health insurance, in many parts of our country, they are finding it very hard to go to a doctor, to get into a doctor to treat the ailments that they have. We fall behind many, many other countries in terms of our lack of emphasis on primary health care, which should be the heart and soul of any strong healthcare system. Bottom line is, when you get sick, you should be able to get to the doctor when you need to and not have to wait weeks and months in order to do so. In the midst of a failing primary healthcare system, there is one very strong bright spot, and that is, for many decades now in every state in this country, we have had community health centers run by the people themselves, democratically run, addressing the health care needs of those given communities. And today in America, we have about 27 million people, 27 men, women, and children who are accessing community health centers. In my own state of Vermont, 1 out of 4 Vermonters gets their primary health care through a community health center. But these centers do more than provide primary health care. They also provide dental care, an issue that is too often ignored when we talk about the health care crisis. They provide mental health counseling, which is more important now than perhaps it has ever been because of the opioid and heroin epidemic our country is experiencing. And equally important, they provide low-cost prescription drugs at a time when so many Americans cannot afford the medicine that they need. That is what community health centers do. And they do it well, and they do it cost-effectively. And to my mind, there is no question, but there is strong bipartisan support here in the Senate and in the House for community health centers. And yet now we have gone over 4 months into the 2018 fiscal year, and we still have not reauthorized funding for community health centers. Now, I frankly do not understand how it happens that when you have strong bipartisan support in the House and the Senate for programs that are working extremely well in every state in this country, I do not know how it has happened that the Republican leadership still has not reauthorized the community health center program. There is good bipartisan legislation right here in the Senate that has, I think, the support of virtually everybody in the Democratic caucus. 7 and 8 Republicans are supporting it. It is the Blunt-Stabenow bill. It is a 5-year extension of community health centers reauthorization with a modest increase in funding. If that bill came to the floor today, my guess is it would get 70, 80 votes, maybe even more. But now we have gone 4 years, 4 months into the fiscal year, and we still have not seen that bill reauthorized. And what is happening all over this country is that community health centers, who often struggle with recruitment and retention, are finding it harder than ever to maintain the doctors and nurses and other medical staff that they need, because applicants are looking around them and saying, why should I work in a community health center if I don't even know it's going to be there next year? Why do I want to stay at a community health center if I got a better job offer and I don't know that this community health center will be refunded? As a result of 4 months of inaction, community health centers all over this country are hurting. And, Mr. President, I would say enough is enough. Right now, as soon as possible, we need to reauthorize the community health center program for at least 5 years, and we may need to make sure that there is adequate funding so that they can continue to do the excellent work that they are doing all over this country. And there's another issue that I would like to just briefly touch upon, Mr. President. There's been a lot of discussion, appropriately so, about the opioid epidemic that is sweeping the United States. We are losing some 63,000 Americans as a result of opioid overdoses in 2016 alone. Families by the millions are being impacted. I was in Brattleboro, Vermont, a few weeks ago, and they talked to me about what's happening to the children whose parents are now addicted to opioids and the need to find foster parenting for those children. So this is clearly an epidemic that has to be dealt with. It has to be dealt with through increased funding for prevention, to do our best to make sure that young people do not get swept up into the epidemic, and also for treatment for those people who are addicted. But there is an issue that we have not touched upon enough, and that is holding the drug companies responsible and accountable for the product that they brought into the market. As some people may recall, in April of 1994, the CEOs of the 7 largest tobacco companies testified before the House Energy and Commerce Subcommittee on Health and Environment in an historic hearing. And what that hearing was about was under oath demanding to know what the executives from the tobacco industry knew and when they knew it. Did they know that their product was addictive? Did they know that tobacco caused cancer and heart disease and other medical problems? And they were asked to hold their hands up and under oath tell the committee what they knew. Well, I think it is now appropriate for the United States Senate to do the same with those drug companies that have produced opioids. I think we need to know what the drug companies knew in terms of the addictive qualities of those drugs. There is some evidence out there that suggests that drug companies, in fact, did know that the product that they were selling was, in fact, addictive, but they forgot to tell the doctors and certainly not the patients. Now, it is one thing for somebody to do something in ignorance, not knowing the impact of what you produce. That happens all the time. But it is something very different if, in fact, the manufacturer of a product understands that that product causes addiction, that product causes death. And we need to get to the root of that issue. We need to know what the drug companies knew and when they knew that. So I would hope very much, Mr. President, that in the Health, Education, Labor, and Pension Committee, which has jurisdiction over this issue, I would hope very much that we can bring those executives of those drug companies that produce opioids before us. Because not only are we talking about 60,000 people a year dying as a result of overdoses, what we are talking about also is the expenditure of tens and tens of billions of dollars on health care and law enforcement associated with opioid addiction. So I hope that we can move forward and have those executives come before us and tell us under oath what they knew and when they knew it, because I think the time is long overdue for us to hold them accountable. And with that, Mr. President, I would yield the floor.